also. So I hope everybody joins in early so that we can start our question answer session. In the meantime, if there are some doctors who had asked me some questions in between for cases and they are much better with that. If the doctor is online, we can ask them how did there was a case of fever and it responded very well. The CRP was, I think, at the time 95 and now it is 15 within 4 days of medicines. It's an interesting case. If the doctor comes online, we'll basically start seeing that case. In the meantime, there was a very interesting symptom, interesting case where the patient had history of cough. The patient had a lot of cough symptoms. He telephoned me and we took that history and he had a typical symptom, he had a typical symptom of cough and says, whenever I start coughing, then I have to eat something. If something is not there, so I have to eat some. He eats some khajur or eats something, and then he starts feeling better. That was a very, very interesting symptom of cough. Whenever there is cough, the cough is better by eating something. So whenever you have this symptom, when the cough is better by eating something, which remedy should come to your mind? Yeah, welcome Palak, welcome Shabbir, welcome Dr. Anja. He had a very, very interesting symptom that whenever he starts coughing, he has to eat something. Anything is not there, he eats dates, that is khajur, and he feels relief. And he has a lot of problem of acidity also. So this was a symptom of that case, and of course there were few symptoms more. The cough was dry and other symptoms also. But whenever if you get these symptoms, the modality which is very important in cough, because see there are so many remedies of cough, right from the polycrase to acute, lot of remedies. But with this symptom is present, you have to think 2 or 3 remedies which are very, very useful and which have given me results in most of my cases. Which remedy can you think about? Anybody? In relation to cough, you should remember, see, because this is cough, cold, coryza, these are symptoms which have to be taken care of so that your practice grows properly. If the patient says this doctor cannot treat cough and cold, so how will he treat the chronic complaints? So it's very, very important to understand and to see that you are able to cure these chronic complaints. So which remedy comes to your mind whenever the patient says the cough is better by eating or taking something in the mouth? Very, very important remedy. Which remedy comes to your mind? Anybody? I give that remedy single dose and the patient just telephoned me and says the cough is much better. Can I continue the medicines? If there is relief, make sure don't repeat the dose. I repeat, don't repeat the dose, otherwise you'll start spoiling the cases. Which remedy comes to your mind? Anybody? Dr. Alina Naz, welcome. Which remedy comes to your mind? Whenever the patient comes, and you will see in your practice also, the patient will tell you the symptom. Few remedies that you have to remember. The first is Spongia tosta, second is Euphrasia, third is Calibrom. So these, of course, there are other remedies. Radium brome is there, other remedies, ammonium carb is also there. But these remedies are very, very important. Welcome, Dr. Sandesh, Dr. Kochar. These remedies are very, very important. So Spongia. Now, Spongia, see, everybody knows that the cough is very dry, as if driven through a saw. Very easy to understand, very easy to learn in a school and college. But sometimes becomes very difficult in a practice. Lot of patients have dry cough. So how will you interpret that? It is like a saw driven through a pine board. Very, very difficult. So this symptom sometimes will guide you to Spongia. One more symptom of Spongia, which I have seen very, very useful, especially when I have a lot of patients out of India from Canada and all, and Canada had a snow worm. So Spongia has a very, very important symptom that whenever the weather is frosty, write down in your Mater Medica, whenever the weather is frosty, the cough is better. I have a lot of patients out of India who say that today the temperature is maybe 3 degree, 4 degree, and suddenly next day the temperature becomes -10, -20 with a lot of frost, and the cough is better. And the patient laughs, I'm surprised that how in frosty weather the cough is better. So don't think about ignition, it's a contradictory symptom. It is a symptom of Spongia. So this is how you have to remember your Mater Medica. Don't always see about that dry cough. This is there, but these symptoms, cough is better by eating, cough is better in frosty weather, or one thing more, in spongia tosta. This is a very, very important symptom I have found in Indian population, given me good results. Can anybody guess one of the symptom of spongia which you should remember and try to ask? If you ask that symptom and confirm, then the remedy is only spongia. Anybody can give me the answer? Welcome, Dr. Motwani. Can anybody give me the answer? Palak. Where it is a very, very common, a very, very peculiar symptom of spongia, the cough is aggravated by dash dash dash. Which is the symptom of spongia? Anybody? I've just cured that case. That's why it is very very, very alert, new in my mind, and I can remember that symptom very well. One symptom of spongia that you should always ask, you should always see in your practice. As I told you, out of India, look for the weather which is frosty and the patient is better. In India, I have seen so many cases that hello Dr. Weber, Babel. So I was just talking about the spongia, and spongia, one thing I told that cough is better by eating something, cough is better by frosty weather, and third, one symptom more of spongia, when the patient does that, the cough is aggravated. Normally, in most of the remedies, by that the cough is better, but in spongia the cough is aggravated. Welcome, Dr. Vishal. So that symptom is in spongia, tea, chai, hot tea aggravates the cough. Remember this symptom, my dear doctors. Remember this symptom. Hot tea aggravates the cough. Of course, there are other symptoms of spongia that you should always know, and those are other symptoms which are good. But this symptom is so many important. Yeah, Dr. Madan, welcome after a long time. So did you know some symptom of spongia? Everybody? Yes or no? I just told you 3 very, very important symptoms of spongia. Clinically, I have seen. I don't look for the dry cough as if saw driven through a pine board. Lot of remedies have dry cough. But now this symptom, did everybody know? First is better by eating. Second is frosty weather ameliorates the cough, and drinking hot tea aggravates the cough. So look for this symptom. And this symptom will definitely guide you to spongia without any mistake. And you can tell the patient that when you take this dose, you will feel much better. So did you get the symptom? Anybody? Yes, Dr. Palak. So this is how you have to grow your practice. Sometimes doctors who join me and I tell some symptoms of the remedy, but there are other symptoms of the remedy which I could not discuss because we didn't have that type of cases. And then you find something very difficult because sir has never told this symptom. But unless the symptoms are clinically seen by me, I cannot tell you. So these are the symptoms of spongia that you should remember, and that will guide you to lot of results of spongia. Of course, try to differentiate between euphrasia, ammonium carb, simple allium sativa also. These remedies also have very, very important symptoms of cough. So this was just a case that basically came to my mind. And of course, the opposite also you should remember. If I have told you the cough is better by eating, you must remember in which remedy the cough is aggravated after eating. So which remedy comes to your mind? Anybody? Where the cough are aggravated by eating. Anybody? Yes, Dr. Madan. Very, very important remedies, very, very simple clinical symptoms I'm sharing with you. I've got lots and lots of good results, So if you have seen, I've seen spongia. In fact, there are some remedies, in fact, I'll take spongia also. Spongia is a remedy which has both the modalities, aggravated by eating also and better by eating also. Now, this sometimes would basically make a difference while asking hot tea and the weather, So you keep thinking which are the remedies where eating aggravates the cough. By the time I take one question from Dr. Alam. Salam sir, eczema की itching में relief के लिए कोई medicine बताइए, itching, aggravation and bleeding. If you ask me, Dr. Alam, and if you go to the repertory and medical, there should be lot of medicines, But sometimes, giving relief sometimes become very important. There are few remedies which you can see in practice, which has given me good results. Of course, I never use specifics now. Before maybe years I was using, but you can think about remedy. First is chrysobium. First, second is histamine. Second, third, echinacea. And fourth remedy that sometimes would help when the itching and scratching is followed by pustules and pus formation, and that is calendula. But two remedies like histamine and chrysobium definitely will give you good results. Chrysobium, also called as acid chryso, have been used in my practice with good results. So let us get back to that cough part. Now, eating aggravates cough. Anybody can share the experience, or anybody can know what are the remedies. Of course, there are a lot of remedies, but give me the very, very important remedies that I use daily in your practice. Yeah, Dr. Vishal? Anybody? Dr. Kochar, Dr. Madan, Dr. Babel? You have to have some mater medica, some symptoms which you can relate to the patient and prescribe very fast. Always don't go to the repertory and don't see the symptoms in mater medica, because sometimes it may become difficult. Three or four, yeah, Brownia is there. Yeah, Brownia is there. Very nice. Brownia is there. Any other remedy? There are 3-4 remedies which have been used very, very successfully in my practice. First is Calibicrom. Second is Naxomica. Third is Coccus cacti. Don't forget Coccus cacti, And fourth remedy is Rumex crispus. Of course, Hippar is also there. Why I'm telling Rumex crispus? Because it has also aggravation from cold weather, cold. And this is a season of cold. That's why very close to Spongia, very close to Drosera, very close to Hippar Rumex is a very important remedy. Of course, Calibicrom, Naxomica, Rumex is there, Coccus cacti. Don't forget Coccus cacti. Brownia is definitely there, Calcarea is there, a lot of remedies are there. But these 4 or 5 remedies very, very important in our practice. Well said, Dr. Lina. So can anybody, I have told you a lot of symptoms about, Coccus cacti. If you have seen my video on cough, I have literally narrated most of the remedies, of cough. But can anybody tell something about Calibicrom? It is a very, very important remedy in cough. Of course, if you have questions, you can immediately ask questions. I will stop the mathematics and start answering you. Yeah, welcome, Doctor. I don't know who is there. I am watching. So I hope, Dr. Alam, you got some answers to your queries. I hope you got that. Of course, if you want, I can share some more remedies, but these are the basic remedies which I have found very, very useful in practice. Now, Calibicrom. Coccus cacti aggravation from loud talking also in dry cough. Yes, very nice, very nice. Yeah, Dr. Sandesh, I'll come to that. So I'll just finish first Calibicrom, and then we'll come back to the question of Coccus cacti. Very well said, Dr. Vishal, and I have told that in practice. Yes. So can we have? Otherwise, I'll basically go to the other mater medica part. Anybody? I'm talking about Calibicrom. So before you basically try answering the question, let me discuss something about Basilinum and tuberculinum. Now, Basilinum. See, Basilinum, it is said that it is a typical preparation from Dr. Burnett, maceration of typical tubercular lung. Calibicrom, yes, stringy mucus is there, Dr. Gill, but I'm asking you something more about Calibicrom. Very, very important. Yeah, Dr. Amit, welcome. It is said that many forms of chronic non-tubercular disease, remember this sentence, Dr. Sandesh, many forms of chronic non-tubercular disease are influenced favorably by Basilinum. Remember this sentence, a beautiful sentence for Basilinum. Many forms of chronic non-tubercular disease are influenced favorably by Basilinum, especially when there is dyspnea and bronchoria is this. In Basilinum, the patient expectorates less. The expectoration is less in Basilinum. Next, in Basilinum, it is indicated for lungs of old people with lot of catarrhal condition. You find that old people coughing. There are a lot of catarrh in the chest, not able to take it out. Those are Basilinum, And Basilinum also, like tuberculinum, has lot of disposition to take cold. This is in short about Basilinum. I hope, and basically bacillum I also use in cases of ringworm which do not respond to the remedy or only responds for a particular time and then stops responding. So as an intercurrent, I use sometimes bacillum, which gives me very, very good results. Now, as regards to tuberculum, there are some things in tuberculum that you have to remember, it is basically, of course, in tuberculum, we will not discuss the tendency to do cash cold or it is something different. In tuberculum, one or two things that you have to remember, it is a very, very important remedy for treatment of incipient tuberculosis and especially adapted to the light complexion and narrow chest personalities. That's why tuberculum is very, very close to phosphorus. We always say it is very, very close to phosphorus. And tuberculum, remember one thing, when the symptoms are constantly changing, and it is written that when best selected remedy fails to improve, and cold is taken from slightest exposure, that is tuberculum with rapid emaciation. And there is the patient of tuberculum is generally very sensitive both mentally and physically. In short, I could just explain you. So welcome Dr. Sharon, Dr. Komal, Dr. Homeopath, Dr. Amit, Dr. Madan. One question we have, tearing, bursting, abdominal pain started 4 a.m., increased bowel movement for the next 4 hours, urging to pass stool, freezing, legs, arm cold, and neuralgic pain like needles, great restlessness with fear. Now see, whenever if you have these type of complaints, Dr. Smith, and you have written freezing, now this becomes absolutely syphilitic. Now, whenever these type of complaints come with severe abdominal pain, you have to think about 3-4 remedies which are very, very important. Think of camphora, think of carbo wedge, think of arsenic alp, and think of phosphorus. Very, very important, So Calibacrum, Dr. Vishal writes, metal-like sound after dinner, undressing, holds thing when cough. Now, whenever basically, you are trying to answer a question, first try to see for yourself, if this type of symptom comes to you, will you give Calibacrum? If yes, then there's nothing to be told. But if a patient complains about just chronic cough and a lot of dry cough, will you give Spongia? How you differentiate? So Calibacrum definitely has this symptom, metal-like sound. Now what metal-like sound is the interpretation of the doctor. That may vary. Here in our YouTube live, I'm just telling you the confirmatory symptom that you have to look about in your practice. More than a metallic sound, you have to just go one step ahead. Dr. Vishal, it could be a resonant cough. It has a resonant sound. But more important, why I'm telling you, in Calibacrum, look one thing, the cough, from inhaling dry smoke, the cough is there, and that is Calibacrum. From inhaling dry smoke, and see, there are a lot of, so I'll just answer Dr. Smith. Arsenic, phosphorus already given. That's why I told you first camphor and second carbo wedge, then arsenic and phosphorus, So these are the symptoms. These are also to be thought about. So you please read these 2 remedies. And one remedy I would like to add, I just came, that is tobacco. Tobacco is also a very important remedy in these type of complaints. So think about camphor, carbo wedge, and tobacco. Yes, so I was just telling about Calibacrum. First symptom is that dry smoke from inhalation, the cough starts. Second, I told resonant cough, and third, there is discharge of acrid fluid from the posterior nares. The patient feels as if बहुत ज़्यादा चुभ रहा है मेरे को. जब the patient हिंदी says तो मेरे को ऐसे अंदर ऐसा लगता है कुछ चुभ रहा है, अंदर से गिर रहा है. The patient feels as if acrid fluid is flowing through the posterior nares, and that is Calibacrum. Very, very important symptoms of Calibacrum cough. One symptom also that you should remember in Calibacrum, there is oppression from the epigastrium, that is Calibacrum cough. Of course, Calibacrum have that metallic taste. Calibacrum has that discharge which are very ropey, stringy, difficult to remove. It hangs in long strings. It is there. But if the cough is dry, how will you prescribe Calibacrum? These are the symptoms I look in my practice. Dry smoke causes cough, resonant cough, and acrid fluid through the posterior nares, and there is sensation as if there is acrid fluid dropping from the posterior nares. That is Calibracho, and that is how you have to read your Mathematica. This is how you have to differentiate in your Mathematica. So welcome to Homeopathy Clinic, welcome Ans Homeopathy, Rahul, welcome Sultan. So I hope you got some of the answers for that cough aggravated by eating. Think about Calibacrom, think about Naxumiga, and as I told you, there are other remedies also which you have to think about. As one of the doctors says Brownia, somebody says Calcarea, somebody says Coccus cacti. Coccus cacti, if you have seen my YouTube video, I don't need to discuss. One thing, more in Calibacrom that you have to remember, that in Calibacrom, of course, remember that stringent discharge, but in Calibacrom, there is pain in the chest when the patient turns to left. There is pain in the chest when the patient turns to left, and that's also a very, very important indication of Calibacrom. Of late, I'm seeing a lot of patients. See, as you start curing with one remedy, you keep studying that remedy, few symptom more, and next time when you ask the patient, he says, yes, this is also symptom in me. So then you make your own Mathematic of the remedy, which you feel will help you clinically, which I speak in my YouTube video, all symptoms which are very clinically seen in my practice. That's why I say it is more of clinical talk rather than just understanding Calibacrom and just telling you the same symptoms which you know about Calibacrom. The stringent discharge can be held in long strings, which everybody knows it. So I hope you are understanding that clinical differentiation of Calibacrom and Spongia, which I told you. Yes, everybody, are you understanding the clinical difference which I look in my practice, and that gives me very good results? Yes, I hope you're understanding, everybody. You can share your views, right or wrong, so that I basically know what to speak in the next YouTube live, because it's been, I think, 2 years and we have a good crowd in the YouTube live. Yeah. So yes, thank you. I think only Dr. Anja is happy. Otherwise, nobody is understanding or what. So these basically, So these basically are very, very important symptoms I was just sharing with you. Now, the question arises in homeopathy. There are some remedies which have both the modalities. See, yeah, Dr. Lina, yeah, Dr. Kochar. Now, there are some remedies which have both the modalities, like cough is emulated by eating and cough is aggravated by eating also. Both the modalities that remedies have. So then you have to look for that remedies also. So there are 3-4 remedies which come to my mind, like Spongia has both the modalities, Anacardium has both the modalities, Euphrasia has both the modalities, and Ferrum metallicum and Calicarb also has both the modalities, like aggravation from eating and cough is aggravation by eating. Cough is aggravated by eating and better by eating. So these are the modalities, which you have to understand. That few remedies have both the modalities in their constitution: Spongia, Anacardium, Euphrasia, Ferrum, and Allium sativa also. So you have to be very sure when confirming your symptom to the patient. Make sure that whenever you're confirming, you have to have some 3 marking symptom which differentiates from one another. That's why your reading of Mathematica, as a lot of people ask me how to study Mathematica, how to differentiate in your Mathematica, and my answer is basically study every day, and clinically when you get results in your practice, write down in your book which you basically follow every day, and keep adding symptoms of that remedy which you have got in your practice, so that you can build up your own clinical Mathematica, and then which will help in practice. Parvinder sent a request to be in your live video. Okay. So I hope everybody got that differentiation of remedies. Of course, there was a lot of Mathematica, but you can keep asking questions. Don't wait. Don't wait for me to finish my Mathematica. Otherwise, I will keep going on in Mathematica, and you will not be able to ask. You will not be able to ask any questions. So you can easily stop me in Mathematica, because otherwise I'll keep on telling you something very different of the remedies. So welcome, Dr. Tamanna, Dr. Fatima, Dr. Karvinder. Dr. Parvinder, yeah. So can we have some few more questions? Dr. Nikhil, welcome. So can we have some more questions? Otherwise, differentiation in Mathematica is basically my favorite topic, and I'll keep on differentiating. But it is very important for you all to understand and ask questions also, that I also learn something, Yes. So any other questions, or we'll continue on Mathematica? Cough and after that fever, homeopathic medicine. Yeah, so see, when there is cough, it is followed by fever. Now if you are only basically what do you call, prescribing on this symptom, then of course I'll tell you the remedies also, but try to differentiate and try to define that symptom more precisely. So whenever you have cough which increases the fever, or cough which is followed by fever, there are few remedies which are very, very important. Of course, I think you must be knowing this remedy, but still I'll tell you. Cough, then the fever starts. The remedies you should think about is, first is arsenic album, a very, very important remedy. That's why most of the cases during acute coughs looks like arsenic album. Then you can have ipecac, you have phosphorus, and you have natrium, which I have used in my practice, which with very, very good results. In fact, arsenic, phosphorus, ipecac, calicum, natrium. This is how it flows basically when I look about in cough cases with fever. Now, one question, a very, very interesting question, aggravation during hysterical attacks. Now, see, whenever, of course, I'll give you the remedy also, Dr. Madan, but whenever you have these type of symptoms of hysterical attack and cough, don't take only that symptom of cough, because in hysterical attack, there are other symptoms. So it's a level of mind. So ask, why did the patient go into hysteria? And then the patient had cough. So one of the very important remedies that you should remember, and you'll be very much surprised, that remedy is Formica rufa. Formica rufa, a remedy basically which, and of course there are other remedies, like we have ignitia also, you have stramonium also, and you have phosphorus also. But Formica rufa will give you very good results. But I still feel that only on this symptom, if you prescribe, the chances of getting cure would be, I don't know whether you get the cure only. But interestingly, Formica rufa has a very, very interesting symptom. Sometimes you will be able to, it comes very close to bryonia. Like there is hoarseness, dry cough, worse at night, and there's very constrictive pain in the chest. There is pleuritic pain. Like bryonia also has that pleuritic pain. That's why the pleura rubs together, and the patient has stitching pain. Better whereas in this Formica rufa, the patient has pleuritic pain. That's a very, very important symptom of Formica rufa with the hysteria, which I confirmed it. But make sure that you ask some more symptoms of cough in relation to cough, Dr. Madan, because I don't know whether this remedy would help you to cure that type of cough. Okay. So let us, of course, Formica rufa, very, very, if you ask me, Formica rufa, use this remedy for rheumatic pain. When you have, it's a very infrequently used remedy. That's why when you have symptoms of joint pains, you think about some other polycrest remedies, but Formica rufa. Whenever there's rheumatic pain, there is very stiffness and contracted joint, think about Formica rufa. Normally we think about causticum and rustox. The muscles feel sprained, and torn from the attachment. Very similar to rustox. And that's why we prescribe rustox, but the remedy is Formica rufa. So these are the remedies which basically are very rarely prescribed, but Formica rufa is very, very important. Try Formica rufa when you feel that a patient is not rustox, but the symptoms are that the muscles feel strained or torn off from the attachment. Think about Formica rufa. Formica rufa also is very, very important symptom. I remember weakness of the lower extremity. Sometimes the patient is not able to get up, not able to walk also. That weakness also of lower extremities is also Formica rufa. The modality of Formica rufa is still more important. the patient is better after midnight and from rubbing. Whenever the patient is rubbing, rubbing, the patient is better. Okay, that's Formica rufa. So one more question, so please tell your clinical experience about prodrome of repertory. No, I have not gone into these type of symptoms, where I have seen the prodrome of repertory. My work is very simple. I basically use, nowadays I'm using complete repertory, but I don't have an experience because I've just started, when I started repertory, I started Kent, then shifted to complete and using that repertory. So theoretically, if you ask me some symptoms or rubric of repertory, I'll answer you. But that question maybe will be difficult because I have not given a thought to that. Yeah, welcome Dr. Indraji, Dr. Divya. Tickling and spasmodic cough with breathless. Tickling and spasmodic cough. I didn't get it. Tickling, cough because of tickling with breathless and strong patient. See, whenever you have these type of symptom, doctor, tickling cough. Now, tickling cough, there are a lot of remedies. I don't know, but if you want, I can give you right. And you have written a very strong patient. So, itching in one point, urticaria and cold. You can think about rust talks, It is there, Dr. Indraji, Dr. Yadav, at one point. So you have to remember strong patient, okay, and tickling cough. Remember lachesis, Nux vomica, phosphorus, Lycopodium, Crotalus cascavella, and Calicar. Very, very important remedies for tickling cough. Acute remedies, think about Rumex, think about, I think sanguinary has that symptom. Think about Argentum nitricum, Argentum metallicum, and think about causticum also. These are the 8-9 remedies, 5 chronic and 5 acute remedies that you should think about. Restox. Restox you can have. So this is itching at one point. So this is, I hope you got the answer. See, urticaria from cold, why did I just answer that question? If there is symptoms of urticaria from cold, there are lots and lots of remedies. You can think about Rustox, you can think about Rumex, you can think about Calcarea carb, Calcarea phos, arsenic, sepia, lot of remedies. But in this, Rustox is very, very commonly used. So think about Dr. Yadav. Think about Rustox, Dulcamar, Calcarea phos, Calcarea carb, arsenic, and sepia. What is the easiest method to learn Matermedica? The easiest method of learning Matermedica is just keep on reading every day one remedy. Don't try to mug up. Don't try to write symptoms important. Not just try to read every day one remedies. Since years, I'm reading one remedy every day. So whenever you have read some symptoms and suddenly the patient tells you, you remember, yeah, I have read somewhere. Sometimes it may not cross your mind, but you think you have read it and automatically it starts coming. Secondly, whenever you cure a symptom with a remedy called Drosera spongia, arsenic, which we use every day, write the symptoms, from which symptoms you have cured. Study that remedy and again ask the patient next time when he comes, if he's better, did he had more symptoms of the remedy, you can confirm. And the patient says yes. So tick mark these 4 symptoms apart from the symptoms which you had prescribed. So you have at least 4 or 5 symptoms of a remedy which you feel clinically the patient had that symptom when you prescribe. So you can make your own Matermedica, and then automatically when you have seen clinically that patients, you will never forget because it is you have cured the case. So you cannot forget those symptoms and keep reading every day. That's basically a mantra for learning Matermedica. So please explain migratory chest pain and the remedies. See, migratory chest pain, what will I tell you? Don't get into that that type of Matermedica where you have the migratory symptoms and all. You can have generalized Bonnegolson concert where the pain is radiating from here and there. So, so I don't think you will be able to get any because see, there are a lot of remedies where it is written that the pain goes from here and there. So in Bonikozen concept, it's a generalized concept. If you use the Boger repertory, it has given everything generalized. So you can write, you can always remember those generalized remedy. Changeability is there, migrating is there from here and there. Think about that lack depth. Think about pulsatilla. Think about those remedies which have the changeability of symptom, rather than being specific only related to chest. That is my understanding of it, because when you treat that symptom of like migratory chest pain, that will be taken care of, something else will start. So instead of that, take the whole constitution, the Boniko's concept, go to the Boger repertory or Fatak repertory also, and then you have that radiating pain generalized, and then you can apply those in your practice. It will be much easier for you to understand those. Sir, I'm having severe backache every morning. I get up at 5 o'clock due to pain, very painful getting up. Once I get up, start walking left. Yeah, so typical first aggression, first motion is there. So don't always think about Rustox first. Add few more symptoms, of backache, which type of backache, migratory backache, and of course, if it is chronic, then the whole case is required. Simple backache, you can try Rustox, you can try Formica, as I said, you can try Arenia, you can try Tarantula, you can try Aesculus hypocastium. Lot of remedies are there. Okay, might be due to chair. Yeah, you can. So if it is basically related to your posture, then basically you have to take care of that posture, because it becomes occupational that time. That's what I'm telling you. It's more of occupational. 80 diabetic, chronic constipation, laxative, diarrhea, weakness of legs, says I can't get up, repeating what will happen. Some stories of toilet 2%. Same stories of toilet 2%. Yeah, this is basically 80 years diabetic patient, maybe suffering from peripheral neuropathy, vitamin B12 deficiency because of diabetes. So in this case, basically it is very important to give supplements also, nutritive supplements like protein and all, and then you can treat those conditions with acid phos is there, uranium nitricum is there, gymnema is there. There are lots of remedies. So that would be a very, very vague prescription, just prescribing it for weakness. Okay, so I hope it's already 40 minutes now. So I hope good session today, and we meet next time with the pending question. I'll see in the next YouTube live. So happy New Year for tomorrow. Today's 31st, and we have completed about 2 years of YouTube live. I think we are nearing 200 episode of our YouTube live. So happy New Year to you. I hope and I wish everybody a prosperous New Year. Thank you so much.